Hello there, and welcome to webinar number 8 of the Health Implications of Food and Agriculture with the Alliance of Nurses for Healthy Environments. We have a few housekeeping things to take care of before we begin. Obviously, this webinar works best on Chrome. Hopefully, you're on that now. If you're having any technical difficulties during the webinar, you're going to need to make sure to close out all other windows that might be open on your computer. If that doesn't solve the problem, you'll need to restart the computer and try logging in again. We hope you'll continue to join us every month and invite your colleagues for our upcoming topics, which will fall mostly on the first Monday of every month, with the exception of some holidays. We welcome questions to the presenters. You can record them on the left side of your screen in the attendee chat room, and we'll leave time at the end of the hour to answer them. But in order to receive your CE certificate, you'll need to complete the presentation evaluation, which will be sent to you just after our webinar today. Please do allow a day or two for those emails to be generated and sent. And then we will, once you've completed that, we'll send the CE certificate. My name is Megan Edelman, and I'm working on behalf of the Alliance of Nurses for Healthy Environments. I'm a nurse and a member of ANI, and I'd like to introduce my colleague, Barbara Sattler, professor at the University of San Francisco. She's a founding member of the Alliance of Nurses for Healthy Environments and continues to be on the ANI board. So we're going to introduce the subject of leveraging institutional purchasing power to change our food systems. Barbara?
Yeah, thank you so much. And it's really a delight to be on this 8th webinar. We've been covering so much ground. And this one, I think, is a synthesis program. And so really, how do we make change happen? How do we affect the food system, specifically from that position of us working in the healthcare sector? And we've covered a lot of ground over the last 8 months, and we've talked about the actual people who work in the food system, the farm workers, the people who are working in food processing, some of the health and safety issues that they are experiencing. We've looked at what's on our food in terms of pesticide residues, and if you have not gone onto the website and used the app, What's on My Food, you can see what residues were on the food that you ate last night. We've talked about the use of non-therapeutic antibiotics in the raising of farm animals and how this threatens the utility of our existing antibiotics. We've also talked a little bit about the use of recombinant bovine growth hormones that are used in cows to increase their milk production, but also causes a host of veterinary problems for them. We've talked about our modern agricultural system in terms of this industrial, non-integrated model that we're working with right now, primarily in terms of food production in this country, both for our produce, but also for our meat animals and poultry, and why that's a problem both for the animals and for the environment, but also for us as consumers. We note that our food in this country and around the world travels long distances, and that has an impact on our environment and specifically on climate change. And one of our last speakers, Dr. Renee Defoe, talked about processed food, and really an enlightening session. If you didn't hear hers, it's recorded and archived on the ANI website. And she talked about an enormous amount of heavy metal and other contaminants that are found in processed foods, and specifically white flour. So we've been learning about all manner of things these past few months. And what we also now need to be thinking about is, how do we take those things maybe one at a time instead of thinking that we have to tackle the whole ball of wax all at once. How do we think of it as a menu of options for things we might change? And through, once again, working through our healthcare sectors, whether we're in a hospital or a school, university, or even a nursing home, how can we help to make changes there? This is a photograph of Louise Mitchell, who will be our next speaker. And on the left is a colleague who we lost a few years ago, who was involved in helping to do the ribbon cutting here for the University of Maryland. First inner city farmers market. It was the University of Maryland Medical Center that developed this, and just to show you the kinds of things that are really possible when we put our mind to it. This is a food desert, inner city Baltimore area, where we were able to click off a bunch of boxes by developing that that food farmers market. And then we also recognize that there are other organizations that are involved in this, and our other speaker today is Emma Sirois, who is the National Director for Healthy Foods within Healthcare Without Harm. She's been with Healthcare Without Harm, which is a national organization that's been helping to green hospitals on a number of different levels, including their purchasing of other products and their energy use and just their anchoring power in a community to help make change. And she's been working for many years on food access and local regional production. And we have her today also giving a talk. And here's a picture of her on the left. And some of the things that we have learned about in terms of buying local, buying sustainable, and making choices that are healthier choices for humans, for the environment, and for the animals. These are things that that Emma and Healthcare Without Harm's food program is quite expert in, and we're going to be letting her focus on that. And let me just say, Louise Mitchell has been working in healthy food and food systems now for 15 or 20 years. She's the woman in the white lab coat here. She directed the Maryland Hospitals for Healthy Environments food program, managed several USDA grants to bring healthy foods to hospitals, and she'll be talking about some of the success stories there. So there are our speakers, and this is the whole Healthcare Without Harm team, and we look forward to hearing from both the speakers and their experiences and what we all can be doing now to have the healthcare system be a real driver to a healthier, safer food system. So thanks for joining us.
Great. Thanks so much, Barb. This is Emma Sirois, and as we're pulling up our slides, my slide deck here, there we go. So Barbara and Megan, thank you guys both so much for inviting me to share with your group today. I'm really excited to be here and to talk with nurses. We know you are the most influential spokespersons within the healthcare setting, and so really appreciate your attention to food and ag issues, and love to help and support you along your journey to be an advocate for healthier food systems. So today, Louise and I are going to talk with you and split up this presentation. Our aim today is really to sort of increase your understanding, build on your understanding of the connections between food systems and health, and then to give you some strategies, tools, and resources that you can use to engage in creating a healthier food system for your patients, for your communities, and for the environment that we all depend on. So these are our learning objectives for today, and I'm going to start us off introducing you to Healthcare Without Harm a little bit more deeply, talking about some of the specific issues we work on and some of the projects that we have going on that you can hopefully engage with to transform food systems, food environments in your communities. And then Louise is really going to dig into some examples of how clinicians have engaged in healthy food systems interventions. So to get us started here, I just wanted to start where we begin. Healthcare without harm is really founded on the belief that as the only sector with healing as its mission, healthcare has an opportunity to use its ethical, economic, and political influence to create ecologically sustainable, equitable, and healthy communities. And we were founded over 20 years ago, and we seek to transform the healthcare worldwide so that it reduces its environmental footprint, becomes a community anchor for sustainability, and a leader in the global movement for environmental health and justice. What we do is we conduct research, we model strategic interventions, and then we provide guidance and resources to help spread and accelerate all of that best practice in the field. And we have programs that are focused on things such as climate and health, safer chemicals, and healthy food, and others. We have a membership organization, Practice Green Health, which is the leading networking organization for sustainable healthcare, and it works with hospitals across the United States, about 1,200 member hospitals currently. So since 2005, Healthcare Without Harm's Healthy Food and Healthcare program has worked to harness the expertise and the purchasing power and increasingly the investments of the healthcare sector to really advance the development of sustainable food systems. We really believe that hospitals are influential institutions in their communities and that they have the power to affect social, economic, and environmental determinants of health in their communities and really promote greater sustainability, equity, and health in the ways that that food is produced, processed, distributed, and consumed. So we have innovation hubs in California, New England, the Northwest, and the Southwest, and I'll talk more about those, where we really model strategies and we create tools and resources to support healthcare facilities and clinicians to become leaders in shaping the food system. And we use these examples then to scale that practice across the country through national campaigns and our membership network at Practice Green Health. And I'll talk about some of those initiatives. We currently have a network of over 1,000 hospitals engaged across the United States. We hope that you can work with us to join that community of practice. So the Healthy Food and Healthcare program is really guided and grounded by the concept of environmental nutrition. So this framework asserts that healthy food cannot be defined by nutritional quality alone. It is the end result of a food system that conserves and renews natural resources, advances social justice and animal welfare, builds community wealth, and fulfills the food nutrition needs of all eaters now and into the future. So we have a white paper focused on environmental nutrition, and following this presentation, I'll be sharing with Megan a document that has a bunch of links, including a link to that resource. So it sounds like the series that this presentation is a part of has already covered a lot of these issues, so this might be review. But I just want to quickly talk about what a food system is. What do we mean when we say a food system? So the food system is the network that integrates food production, processing, distribution, marketing, consumption, and waste management. And we know that the way that our food is produced, processed, transported, made available for consumption, and consumed really does have profound impacts on environmental, public, and individual health. At each point in the food system, there exists an opportunity to really support the health of workers and eaters and the biological systems on which health depends. However, our current food system is failing to meet these opportunities and resulting in a rising tide of diet-related disease, inequitable access to healthy food, health and economic challenges for farm and food businesses, and environmental degradation, which further impacts human health. You can see here a number of specific and expansive issues related to our current food system, with diet-related disease on the rise. In the United States, the most affordable and frequently consumed diet is high in calories, refined carbohydrates, unhealthy fats, processed products, and animal-based foods. The 4 leading causes of death in the country and the largest source of healthcare expenditure are directly linked to food. These are stroke, diabetes, cancer, and cardiovascular disease. The estimated healthcare costs for obesity and diet-related chronic health diseases range from $147 billion to nearly $210 billion per year. We know that food security is a significant issue in our country. 12.3% of U.S. households in 2016 were food insecure at some point during the year, and this food insecurity correlates with higher healthcare costs, totaling $77.5 billion per year in the United States. Sounds like you guys have taken a deep dive into industrial agriculture and its related health effects. We know that conventional agriculture relies on industrial scale operations with really high inputs of energy, water, chemicals, pharmaceuticals, and this produces a range of negative human and environmental health impacts, including antibiotic resistance, respiratory illnesses related to the exposure of pesticide drift or manure-related ammonia emissions. In particular, occupational exposure to pesticides is linked to asthma, chronic bronchitis, and increased risk to certain types of cancer, such as leukemia and lymphoma. The confined animal feeding operations, where animals are routinely provided antibiotics, have been found to contribute to higher rates of antibiotic-resistant bacteria. These confined animal feeding operations cause additional harm to the safety of our water supplies and reduce the air quality for the surrounding community. Finally, climate change, agriculture, and food access are all connected. Consistently accessible and affordable healthy food is really put at risk by climate impacts affecting our ability to produce food. These include floods and droughts, increases in pests, and changes in the average temperatures and growing seasons. The Intergovernmental Panel on Climate Change estimates that agriculture and associated land use changes are now responsible for 24% of global greenhouse gas emissions. That's greater than the emissions from industry and greater than the combined emissions of transportation and building. So with that, we have to ask, what does a healthier food and sustainable and equitable food system look like? And some of the key opportunities for strengthening our food system to really support human health and create a system of resilience to withstand the changes and the challenges that lie ahead include some of these. So increasing healthy food access for everyone, localizing our food economy, that means buying from local and regional producers, reducing agricultural's impact on natural systems, air, water, soil, climate, and improving agriculture and food policy to promote food system sustainability and equity. And it's really important to note that these opportunities can really be stacked for greater impact. For example, when you're working on a healthy food access program, you can integrate strategies that support local and sustainably produced foods, and that together this can have a combined positive health impact while supporting regional farmers to create a more resilient system with fewer impacts. So with the Healthy Food and Healthcare Program, we have seen a number of strategies emerge, and there are really distinct opportunities for healthcare and health professionals to engage in improving food systems and food environments, both on campus or inside the hospital and in the community. So some of the strategies we see inside the hospital are hospitals using their food service purchasing to support regionalized and sustainable food production. And in some examples, really actually growing food for food service right there on campus. We see improving campus food environments to be healthy by default. This strategy both provides access to healthy food, but it also serves to promote healthy eating for patients, staff, and visitors. And finally, we see hospitals addressing food service operations and that have environmental impacts, such as food waste reduction and recovery for donation and composting. Outside of the walls of the hospital, we see a number of key strategies. These include increasing access to healthy and affordable and local and sustainable foods in the community through initiatives such as community gardens and farms, produce prescription programs, farmers markets, mobile markets, CSAs, farm to school, and much more. We see hospitals and clinicians working on increasing community knowledge of healthy eating and supporting local and sustainable agriculture practices through teaching kitchens and other hospital community collaborations. More recently, facilities and systems are leveraging their community benefit programs and other investment opportunities to support these interventions and really expand the reach of their impact. Finally, clinicians and other healthcare professionals are advocating for change at the public policy level, where their health expertise and perspective can really be a critical motivator for policymakers. So I wanted to highlight just a few of our current initiatives and point out where you might find related resources to inspire and support your engagement in food systems work. So I'm going to start with a project that we conducted just a few years ago. We conducted a research and resource development project really aimed at understanding the opportunity and best practice for using hospital community benefit programs to develop community health interventions and promote healthy food access. And from this, we developed something called the Delivering Community Benefit Healthy Food Playbook. This is a suite of online resources, and it supports the different stages of community benefit process. And each resource in the playbook provides examples and links, and I've provided here the website so you can view the full playbook. As clinician advocates, there are several of these implementation resources that are that may be of particular interest to you, and I've highlighted just a few of them here. So there's a series of resources that look in particular at intervention types, and they contain examples from hospitals studied with suggestions and implementation of these models. And you can see here there's a guide for Veggie RX programs, another for farmers markets, and then another for healthy corner stores. Another resource that may be of interest is a resource called Identifying and Working with Community Partners. This is a good, robust resource that uses examples that we found from our research about how hospitals and clinicians and health professionals are connecting with community-based organizations to do these projects, and might give you some good ideas. And finally, the resource highlighted in blue is the Hospital Community Benefit Roles document, and this is a good review of all the ways that hospitals can engage their community benefit programs to support healthy food programming. Another exciting model is one that is exploring the community health impacts of collaborating anchors. And it's called Anchors in Resilient Communities. And this is a model we're currently executing in the San Francisco Bay Area. It is a multi-sector collaborative that was developed by Healthcare Without Harm and the Emerald Cities Collaborative. And it is seeking to address the social and environmental determinants of health by leveraging the assets and capabilities of the Bay Area anchors institutions, such as hospitals, schools, and universities, and working with community partners. And it has a focus on expanding community wealth and ownership, and improving health outcomes, and strengthening the capacity of communities of color and low and moderate income residents so that they are more resilient in the face of climate and economic disruptions. So the institutions participating in this anchor table undertook an assessment of their collective demand for products and services, and they also looked at the existing capacity of Bay Area businesses that could ramp up to meet those demands. They found that collectively they purchase goods and services totaling over $6.8 billion every year. And then they went on to identify a couple of different priority areas that they're working on. One of them is local food, another is clean energy, and a third is green business enterprises, things like laundry. And together, the table decided to focus first on their food goals. And the first project that they're working on is a regional food processing center that's going to be sited in the East Bay and will be producing ready-made meals for area institutions using local and sustainable food products and providing living wage employment opportunities for the community. So this is an exciting project. If you're in the Bay Area, we'd love to hear from you and find ways for you to engage with this project. And we're currently evaluating it and looking to expand this model to other regions. So, hospital food service purchasing is really still one of the most direct strategies hospitals can use to improve the food available on their campuses and really support regional food economies and sustainable ag practices. And several of our recent initiatives have demonstrated how institutions can collaborate on these purchasing initiatives. And these are two current projects, ProcureWorks and Nourish. And from these, we've learned a lot about how to create synergy across institutions and to bring their purchasing together to create opportunities for local and regional producers, and also how to market that to patients, staff, and visitors that are eating in the food service. And so there are a number of resources that came off of these projects, and you can see a few of them listed here, and they'll be highlighted again on the resource list I will share. So we know that there are a multitude of health benefits from eating a plant-centered diet. And these include lower risk of developing coronary heart disease, smaller waist circumference, lower amounts of abdominal fat, lower cholesterol, lower blood sugar, lower body mass index. And for healthcare, less chronic disease means less cost. And we also know that plant-centered eating has benefits for the environment. Plant-based proteins require less water and land to produce, and they have a significantly lower carbon footprint than the animal-based products, such as meat, dairy, and eggs. So animal agriculture globally accounts for about 25% of the total global greenhouse gas emissions, statistics from the Food and Ag Organization of the UN. Healthcare Without Harm has therefore partnered with the World Resources Institute to bring their Cool Food Pledge to the healthcare sector and provide the technical support to participating hospitals. So the Cool Food Pledge is really an opportunity for institutional food service operations to reduce their food-related greenhouse gas emissions, and then to tie their health-promoting, plant-centered meal efforts to climate change. So it's a cross-sector international effort, and it seeks to achieve a science-based collective target of reducing emissions from food by 25% by 2030. So it's a collective goal, and we're seeking to engage hospitals in this pledge right now. We have over 35 hospitals across the U.S. that have signed up and pledged to be a part of this, and we're just beginning to work with them. And so participating hospitals receive technical assistance and support from Healthcare Without Harm and Practice Green Health, and this includes baselining, planning their changes, their purchasing and menu changes, and tracking their progress. And you can help by sharing this pledge with the food service and others in your institution, and supporting them and advocating for them to sign on. It's a wonderful way to connect the hospital's work with healing mission with the food department and their climate mitigation plans. Another project or another activity I want to introduce you to is our Clinician Champions for Comprehensive Antibiotic Stewardship Collaborative. This is a joint committee of Healthcare Without Harm, Pediatric Infectious Disease Society, Sharing Antimicrobial Reports for Pediatric Stewardship Group, and US PIRG, or the US Public Interest Research Group. The CAUSE Collaborative aims to increase knowledge within the clinical community of the link between antibiotic resistance and antibiotic use, and its use in agriculture to really promote policy action that supports judicious use. They provide education. They have monthly and quarterly meetings. They have education sessions. They create advocacy opportunities, and they have a number of tools and resources. This antimicrobial stewardship through Food Animal Agriculture Toolkit module is one good example of a good resource that can help you think about how to engage your facility in a dialogue about stewardship and the relationship to food purchasing. So with that, I wanted to leave you with just a set of sort of recommendations that you can use to kind of engage with our organization and program and the resources that we have. And I'm going to, with that, turn this over to Louise. So we have time for questions at the end.
Hi there, this is Louise. So I'm going to talk about how nurses can engage their healthcare facilities in providing healthier foods. Next slide. I'm dedicating this presentation to Denise Chouanière, who I worked closely with at Maryland Hospitals for Healthy Environment. She was a steadfast advocate for providing our patients, our staff, and communities with healthy foods, and she made significant change at University of Maryland and in the community. Next slide. Wanted to be clear about defining healthy food. So it's nutritious, whole food, environmentally sound food, it's economically viable, and socially responsible. And these are the foods that nurses have been advocating in the state of Maryland for hospitals to start to provide to patients, staff, and the community. Next slide. It's important to create a culture of health and well-being, and because we're influenced by the culture and by what's around us, you could start with doing a baseline assessment and look at what kinds of healthy foods and beverages are available and what stands out as not being available. You could look at information that's being shared about healthy food, which staff members are and maybe administrators are eating healthy, what stories are in the hospital about nurses and other clinicians and other staff members that are passionate about healthy food and advocating for it on their nursing unit or in their department. And you can look at what media is available right now about your hospital facility related to providing healthier food. Not only internal newsletters and social media, but also externally in the community. And another kind of good way to think about the culture of healthy food, what is it that people, you know, when patients come to the hospital or your healthcare facility, and staff, of course, what is it that you see around? What are people hearing about it? What smells are there? And how's the food tasting? And of course, touch. So you want to identify where you could have influence in the culture, in the food environment. Next slide. So specifically, what kinds of initiatives could nurses implement to create a healthier food environment? Not necessarily in food service, but in other places in the facility. So of course, you can influence the food environment on your nursing unit. For example, you could reduce or eliminate soda. Some facilities have eliminated all their soda except for ginger ale because nurses have been advocating for that. You could also serve herbal ginger tea as a substitute. You can increase your healthy beverages and increase healthy snacks on the nursing unit as a place to start to create a culture of healthy food on your unit. Another thing that's helpful and kind of easy to start with is to invite a local farmer to come and have a farm stand in the hospital lobby or outside the cafeteria. It can be a one-time event or something that you regularly host. It's not as big as launching a farmer's market. It's a nice place to start, and it changes the food environment. Also vending, the vending machines are typically not run by the food service department. It's usually in another department in the hospital. And so you could start to advocate for healthier foods in the vending machines. And I have a resource at the end for option or how to go about that. Next slide. You could launch a farmer's market at your hospital. Denise launched a farmer's market at University of Maryland Medical Center and at Johns Hopkins Hospital. Ronit Malin and Shannon Greger teamed up as nurses, came to a buyer-grower meeting that we had. That's the Secretary of Agriculture that they're standing with in the picture. And they came to a Department of Agriculture event that connects buyers to growers. And so they use that resource to find farmers for the market. You could also launch a CSA at your facility where you would have weekly shares of local healthy food being delivered to your facility once a week during the growing season. Next slide. You could launch a garden at your facility, whether it's a hospital, nursing home, or a mental health center. Here we have a nurse in Baltimore, Sharon Traceman, who works at Johns Hopkins Bayview Medical Center in the community psychiatry department, program, which is an outpatient program. And she launched a community garden for the patients to participate and engage them in eating healthier food. And then Annette Fleischel, who's a nurse, the performance improvement director, or she's retired now. She worked at a nursing home in Baltimore, and she launched a garden for the residents and engaged them in growing healthy food. Next slide. You could also lead a green team or launch a food committee. Nurse Colleen Cusick at Johns Hopkins Hospital, she led the green team, leads the green team at Johns Hopkins. You could also host some kind of competition or cook-off. Inova Health in Virginia, they launched CEO. They have several hospitals in their system, and they did a competition between two of their CEOs and had the staff vote on which menu item was the best. You could, next slide. You can also host educational events that help engage staff in why it's important to eat healthier and how to go, strategies that they can use to do that at home. Recognition is a very smart strategy. If you have taken your kind of baseline assessment and identified what healthy foods are being served and provided already, you can recognize staff for doing that in a hospital newsletter, on your social media pages at the hospital. There may be a nurse doing an initiative on her unit specifically or his unit specifically. And so you want to recognize people because it helps build momentum, it helps engage them, and it helps engage more nurses and others to participate. You could also participate in the national campaigns and use the national campaigns as a way to catalyze participation. So right now, National Nutrition Month is just coming up in March, and the American Dietetic Association is preparing for that campaign, and this is their logo for 2020. There's also the Food Day campaign, which is on October 24th every year. And Healthcare Without Harm has a campaign to engage people to participate around the country in Food Day. Next slide. So now looking at a few of our champions in Maryland that launched healthy food, a variety of healthy food initiatives. So Denise, she started with farm stands just outside the cafeteria, and then she launched a farmer's market on the campus. That's in a park across the street from the hospital there in the picture. She had initially over 12 farmers and vendors. She was the first hospital market in Maryland to provide EBT, which is a federal benefits program, for SNAP recipients, which is formerly food stamps. She also teamed up with the Maryland Farmers Market Association to provide Maryland market money, and every state has an incentive program for people receiving benefits to double their purchases, double their value. And so in Maryland, ours is called the Maryland Market Money Program. And so that's a nice incentive for people to attend the market. She also engaged a school to bring the children to the farmers market on a regular basis to learn about healthier foods, and she served WIC and senior check recipients as well at the market. Next slide. She also worked closely with the food service department to influence the food purchasing in the cafeteria. So she started with local foods, which is a nice way to start because you can, the food service staff can order food through their distributor that's from local farmers, and there's been a significant increase in distributors identifying which of the foods are from local farmers. And then the cafeteria staff can label the foods that are local in the salad bar or on the menu and promote that. And that's a great way to engage people to eat healthier food. She also reduced the meat purchasing in the cafeteria, well, in the food service, and launched a healthy beverage initiative. And she shared her lessons with many other nurses, not only through educational seminars and webinars and presentations, but also, one-on-one as people contacted her for more resources. And she was the first hospital sustainability coordinator in Maryland and won multiple awards. So here's some pictures from her Healthy Beverage Initiative. She used the labeling program where you identify the beverages that you don't want people to purchase as much with a red stop, label or color. And then Rethink, often diet beverages are included in the Healthy Beverage Rethink Your Drink initiative, and then promoting healthier beverages in the green for Go. So that's a kind of a way to color code things in your cafeteria, and you can encourage your food service staff to do that. You can also help them to help, give them some capacity to launch these kinds of initiatives, which is what Denise did. Now, strategies that you can use to engage your food service department in providing healthier foods, not only in the cafeteria, also for the patient trays, obviously, and then you may have an on-site cafe as well. Next slide. So where to begin? Now, these are things that you can use. These are ideas that you can use when you're moving forward on launching healthy food initiatives at your facility, and these are things you can also kind of keep in mind and potentially encourage your food service staff as you start to meet and talk with them. Identify what initiative might be easy to start with, where there's already a product that's available that they can switch and where there's not a big cost difference. And that helps build momentum and, bring on quick wins that staff can kind of feel positive about as they're moving forward on these initiatives. But also, of course, you want to incorporate and encourage your food service staff to purchase foods where there's a great risk to health. Or if it's a long-term project, just start to take small steps. Like you could host a menu, something on the menu or in the salad bar once a month. Maybe it's organic strawberries or other foods that are sustainably produced. Maybe it's grass-fed meat on the menu. So start to pilot things and start at a small scale and then build up. Charlotte Wallace is another nurse in Maryland that is a pediatric nurse and became the sustainability coordinator at Anne Arundel Medical Center. And she started with several initiatives, first encouraging, she worked very closely with the food service department and engaged them in purchasing more local food and working closely with their distributor to identify which foods were from local farmers. They also increased menu items that were seasonal, so that encouraged the use of local foods. She would help the food service staff with highlighting those featured items and promoting them to the staff, and used a wellness initiative that they launched to kind of promote that. She also launched a healthy beverage initiative and a less meat, better meat initiative with a local producer that was selling through the distributor. So it made it a lot easier for the hospital to purchase it through their existing distributor. Next slide. She launched a farmer's market on site in the hospital lobby. And she also hosted local chefs from the community that were restaurant chefs to come and do cooking demos to engage staff in eating more fresh local food. Next slide. She also testified, but she had the opportunity to meet with President Obama to advocate for climate action due to the health impacts, public health impacts. And she testified in the Maryland legislature to ban arsenic use in chicken feed in Maryland, and with the efforts from healthcare, which made a contribution to this decision, the legislators did ban the use of arsenic in chicken feed. And then the momentum kept building, and that practice was banned, or was banned by the FDA on a federal level. Next slide. Justin Graves is a nurse that also works at University of Maryland Medical Center, who and Denise tucked him under her wing. He was a clinical nurse and then moved towards sustainability initiatives, and then gradually phased into doing sustainability full time, and now is the director of materials management, logistics, and sustainability at the medical center. He leads the green team and now runs the weekly farmers market. And he also is working closely with food service and taking things much further. He implemented a price incentive program to decrease the cost of decrease the cost of healthy foods and increase the cost of unhealthy foods to incentivize people to make healthy choices. He worked with the cafeteria staff to address where to place healthy foods so that they're more visible and easy to reach, and people are kind of more drawn to choosing those healthier options. And he also strategized to shift where the unhealthy foods were and reduce their presence in the cafeteria. And finally he launched a rotisserie chicken initiative where they serve chicken that's produced without the routine use of antibiotics in the cafeteria. So they roast the chickens whole in the kitchen, and then they serve them a quarter roasted chicken in the cafeteria menu. And he too testified in the Maryland State Legislature. This time it was to ban the routine use of antibiotics in animal agriculture in Maryland, and this also was passed into law. And Justin's been recognized as well with many awards. So his price incentive pilot program, he kicked it off on Earth Day, and he targeted 5 healthy items and 10 unhealthy items. He let staff know about the employees know about the changes that they were making in the pricing, and they provided nutritional information at the grill, and then they did some evaluation of the purchasing behavior. They looked at sales actually in the cafeteria over a 16-week period, and they did find that the sales increased with the healthy options, and the sales decreased with the unhealthy options. Here's an example of the data he collected, it's not the data he collected, it's the price points, on the food. So the veggie burgers, whole fruit in the cafeteria, and also the salad bar, yogurt, and bottled water. They reduced the prices of the healthy options by 18% on average. And they increased the prices of unhealthy options, and you can see they took hamburgers, cheeseburgers, chicken wings, fried chicken, soda, and French fries. And that they increased those prices by 19%. Next slide. One other place that you can start to shift the culture and the food environment is to take some steps forward on making the food service more sustainable. So you're kind of adding to people's awareness of going green and the connections between the toxins in the food and in the products packaging that will by selecting items that are manufactured in a healthier way, it connects to improving people's health. So, for example, compostable dishware, obviously composting initiatives, and green building initiatives that, if many kitchens do renovations. So promoting those kinds of initiatives in food service also help to shift the culture towards a healthier environment. So some resources that you can use to implement these initiatives and improve the food environment. Practice Green Health. If your facility is a member of Practice Green Health, that allows you to gain access to multiple tools and resources that Healthcare Without Harm developed. Our program, Maryland Hospitals for a Healthy Environment, we developed some tools that allow nurses and other clinicians and other staff members to have ideas on how to take easy steps to buy local food and how to demonstrate those ideas to your food service department. Ideas for engaging customers in making healthier choices, and also, cost-saving strategies and revenue-generating strategies for purchasing healthier foods, especially local sustainable meat and poultry, and also other sustainable foods. And there are several other resources, including a case study called Plow to Plate that's really well done, and that gives you a great idea of the journey that process took for them to serve healthier foods at their facility. We developed in Maryland, a farmer that I work closely with developed a farm to hospital fact sheet that was more geared towards farmers, but it also provided some information to the hospitals as well. There's a national farmers market coalition, and most states now have a farmers market association that you can receive resources from them and assistance in launching a farmers market. Next slide. Some healthy beverage tools and resources include the one that the Boston Public Health Commission developed on a healthy beverage toolkit. And then the federal workplace has two tools, one called concessions and cafeterias, and the other one called health and sustainability guidelines for federal concessions and vending operations. So now it's time for questions.
Thank you. That was very informative from both of our speakers. We do have one question. I think it's for you, Emma, or actually, I'm sorry, it might have been for Louise. Karen is asking, why was arsenic used in the chicken feed? Was it a contaminant?
Right. Yeah, arsenic was used in chicken feed because it helped. There was it's a component called roxarsone, and it helped address a parasite in the gut. It helped kill this medication killed a parasite in the gut of chickens. So it helped manage the health of the animal, the chickens in the confined feedlot operations. But many farmers have discovered that they can raise healthy chickens even still in confined feedlot operations, even though that's not what we want them to do, when they manage other components of the environment. And as they increase the kind of space that chickens have to move around, they've discovered that they don't need this component this medication called roxarsone. And they also discovered that arsenic helps chickens grow faster. That was a kind of a side, quote unquote, benefit that the farmers discovered after using this roxarsone to treat this parasite in the guts of chicken.
Yeah, and I'll just add that there was FDA withdrew their approvals for a whole group of these arsenic-based animal drugs back in 2013. So this is work that Healthcare Without Harm and organizations like the Maryland Hospitals for a Healthy Environment worked on together to advocate for. So it's a good story in terms of the power of advocacy of clinicians.
Absolutely. Do we have any other questions from our attendees today for our presenters? Kesha is asking, how do I find out what food laws exist in my state?
You can talk to the Department of Agriculture. There are people that specifically are kind of, that's their job. And we had a very accessible resource person at the Department of Agriculture here in Maryland that I would contact when I had questions.
Okay, Helen Boyd has asked, in the healthy beverage program, are plastic excluded due to the risks of health of plastic pollution? Shouldn't beverages in glass bottles be encouraged?
Yes, absolutely. Beverages in glass bottles. There's a process. So usually things are phased in, and there are definitely hospitals that are using more infused water, or those stations that you can get where you can, dispensers that have filtered water. Most hospitals now have those dispensers with filtered water, and that's kind of the old water fountain. So yes, absolutely. Many facilities are moving towards that, and that's a sometimes they start with something that's easy, and that if the food service department might be a little resistant, so they kind of make a compromise to get started and then build on that over time.
Great. And how can our audience members connect with Healthcare Without Harm's food work?
I just sent a handout to Megan. Megan, if you can forward it to those that are attending today. It's got a bunch of links. And in particular, you'll see also I included links to our different regional projects. So if you happen to be in California or the Pacific Northwest or New England, you can visit the page where we have information about all the projects going on and the organizer that you can be in touch with to get involved there. And if we don't happen to be in one of those locations and you're still looking for support, there's some other ideas there on that sheet.
Great. I will be forwarding those. Probably actually we'll be posting those on the Annie website with the recorded link, the recording link for this webinar. And you'll be able to access those. But if for any reason attendees do not get that, you can be sure to email me directly, and I will get it to you. And I'm putting my email right now into the chat area for you to copy down. So if we don't have any other questions, we'll probably sign off. I'd like to remind everyone we do have a webinar next week, or next month, apologies, on the 3rd of February, and that's going to be covering food insecurity. Barbara, do you have any last words? And if nobody else has any other questions, we look forward to having you participate with us next time, and Happy New Year to everyone. Thank you, and we'll see you next time.
Thanks,
Bye-bye.
everyone.
Thanks to our presenters.
Thank you.
Oh, Megan?
Thank you.
Oh, sorry.
Yeah, I'm sorry. This is Barbara. I apologize. I couldn't get myself off mute. Two things I just wanted to remind folks, if you didn't tell them, that all of the previous webinars are archived and they can watch them. And the other thing is that early in 2020, which we're in, we're going to be contacting all of the nurses that signed up for any of the webinars and begin to actually have some interactive meetings so we can talk about how we can work together and support each other's efforts and provide resources as they are necessary as everybody moves forward with their work. So just wanted to add that. Thanks.
Thank you, everyone. Happy New Year, and we'll see you next month for more discussion on the health implications of food and agriculture. Take good care.
Bye.